You can see why people are nervous, though, ahead of the Monday when that step 2 will be released. You know, we've got 8,000 new infections a day. That's a high level of infection still. An R rate of between 0.7 and 0.9, just a little under 1. An untested contact tracing system that's only just been set up. An app that is still in pilot. Are we heading for another resurgence?
No, and as I described and I set out at the start of this interview, the number of new cases Friday compared to the previous Friday is down by over 800. The number of people in critical care with COVID-19 is down by over 200. The death rate, if you take the trend data, is coming down. And it's because of that progress that we can take the steps that we're taking tomorrow. But you're right that people should be cautious. And one of the things that the scientists have said to us is that we can take these measures, but people must still adhere to the revised social distancing rules and the guidance that we put out. So yes, we are cautiously proceeding, and yes, people do need to follow the guidance, but we are confident that this is the right step to be taken at this moment in time. And of course, because we've got the test and tracing system up and running in effect, where we see any upticks, we can target our approach very carefully, and that's the whole point of the test and tracing system, so that we've got control of this virus and we can continue the pressure to keep it coming down as we take those cautious, sure-footed steps forward, both on schools, on the economy, and also, you know, you look at the people that have been shielding, over 2 million people that have been shielded, elderly people with a particular condition. We understand that very responsibly, very carefully, but they will feel the need and want to come out and have some outdoor exposure to be able to go for a walk outside. So we're taking those steps, and the guidance on that will be set out by the Community Secretary later on today. We're taking those steps very carefully based on the science, but also based on our ability now to monitor the virus in a way that we hadn't had before. And that's a tribute to the work at DHSC, getting the testing and tracing system up and running, and we're continuing to look at reinforcing that at every step along the way.